They are your exclusive local experts in orthopedics and sports medicine and rheumatology.
Well, the first step in recovering from pain is getting the correct diagnosis.
Today with OSMS, they discuss the wide range of diagnostic services and tools they offer to get patients on track to healing.
Good morning. Thanks for having us today. My name's Lauren from OSMS, and today I'm joined by Mandy Kostreva. She's one of our orthopedic clinic managers who also oversees our diagnostic imaging. Mandy, thank you for joining us today.
Thanks for having me.
Yeah, so today we're talking about diagnostic services, the ones that we specifically offer at OSMS. But can you first tell us what are diagnostic services?
It's a great question. So diagnostic services are basically tools to help test, diagnose, and monitor health conditions. So typically those are found in lab or imaging environments.
Thanks for sharing that explanation. So now that we know what diagnostic services are, can you tell us what ones we specifically have at OSMS?
Yes, for sure. OSMS has a lot of services that we can provide diagnostic testing with. The first and foremost one is probably just general X-ray. It's a simple, easy, cost-effective way to assess for a fracture, a dislocation, or deterioration in the bone. Once our physicians evaluate those radiographs, there are times where they want further evaluation for something they may not be able to see on the X-ray itself. That's where we get into something we would call MRI. So MRI uses a very powerful magnet, radio waves, and a computer to generate images of the soft tissue, muscles, organs, things of that sort. It's really good for identifying meniscal tears, ACL tears or injuries, spine abnormalities, or rotator cuff tears. Ultrasound is also a really great way to identify things going on in the tendons, ligaments, muscles, joint spaces as well. It's a very non-invasive procedure that uses ultrasound waves to produce its images. So we identify conditions like arthritis, tendinitis, carpal tunnel syndromes, and things of that sort. Then we move into what we call fluoroscopy. That's probably one of my favorites because it's a live video of your insides. So we will use fluoroscopy to use as a way to identify needle placement so our physicians know exactly the joint space or the area of interest they're trying to reach when they're injecting medication, pre-contrast for MRI scans, and things of that nature. Bone density is a very low dose X-ray that we utilize to identify how much calcium or what minerals are in the bone. Our rheumatology department is using this as an initiative right now to really identify how strong patients' bones are or what their risk of fracture is. And last but not least, we offer something called extremity CT scan. So what that does is it gives us a 3D image, allowing us to look for the same things like bone fractures, bone joint alignments, or any abnormalities that would be in the bone.
With our diagnostic services, are they available for just our patients or are they available to the community?
They are available to everyone, so not just our patients within OSMS, but we have a lot of community members, affiliations, and agreements with different people within the areas that come see us, but also if you are not affiliated with anything OSMS or any healthcare organization for that matter, you can walk in and we will take care of you the best that we can with the tools that we have.
Well, if anyone has questions about our diagnostic services or would like to schedule an appointment with us, you can do so by calling our number at 920-430-8113, or you can also go online at osmsgb.com.
OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh.
Once again, to make that appointment, 430-8113 and online, osmsgb.com.